Hello, and welcome to this very special six-part series on women's pelvic health. I'm Rajana Novkovich with Speaker Story Bank, and as many of you know who have worked with me or know the work I do, Speaker Story Bank is all about elevating the thought leaders, the voices, the people who are helping us think differently, but more importantly, do differently. And today's guest, and for the next 6 weeks, my guest is Dr. Nicole Fleischman. And she is incredibly special because not only have we been great friends for over 25 years, but she is a distinguished surgeon and urogynecologist, and she is incredible. Nicole, you are going to be sharing some incredible content with us over the next 6 weeks, and it is all based on your practice for over 25 years as a urogynecologist, and also this new book that you've written, The Second Mouth. And this is why we're calling this series The Second Mouth, Women's Health from the Bottom Up, because yes, ladies, we do have another mouth down below that I guess, Nicole, we have not been paying attention to, right, my friend? And we are here to really tap into all of that. So welcome.
Thank you so much. This is such an evolution, Mer, because we've been chatting every week for the last several months about doing something like this, and it's fun to kind of go live, even if our technology is challenging for me. But I'm
It
gonna
is.
get it.
It's okay. It's okay. It's a challenge. We're here to be challenged. And as long as people can even hear us, we're good.
Oh,
But
I hope so.
listen, where I really want to start is just because we're doing this over 6 weeks, we're going to be diving into a lot of different things. I just want people to get to know you and know and understand where this is coming from you. This is coming from 25 years of practice, and only in the recent, what would you say, last 5 years, you tell us that you've been starting to tap into something deeper about our pelvic floor health that you've been discovering with your patients that's going to take us into a more conscious and intentional place with it. But let's start there so you could just kind of share with us where you've come on your journey with all of this.
Well, this really does feel like a journey. And I think you need to feel like you're on a journey to write a book. It's not easy to write a book. I mean, listen, anybody can write a book these days, but it takes a lot of work and it has to come from a place of real wanting to do it. And I decided to write the book because I literally had almost like an awakening within my practice a few years ago, where I realized that I was really missing something, or I had been missing something, and when I saw what I was missing, when it hit me, it was like a ton of bricks. I can only explain it like it was a crash. And it was a huge aha moment where all of a sudden, all the things that I had learned, all the things that I had experienced, all the things that I had read suddenly made sense to me. That's the only way I could explain it. And
Mm,
and now that I'm looking back on that time, I realized that I was practicing medicine by the books, and I had gotten really good at learning the books and learning the algorithms and learning what to do in different situations, but I wasn't practicing medicine in a soulful way. I wasn't getting to the heart of the problem. And I
mm,
knew I was missing things along the way because, when you practice by your book and not by your soul, you don't have the outcomes that we're talking about. A gut intuition, it's sort of a knowing of what's going on, and yet if the doctor ignores those things, we tend to not do as well for our patients. So I started paying attention to the callings within my own body that I was missing something. And when I started to listen, I realized that I didn't have the correct concept of our own functional anatomy. And
mm.
that is the basic premise. I realized that we did not understand we had a mouth mechanism on the other side of our body. And I had never been told this. It's just something I finally understood.
Yeah. So okay. So again, we've been hearing a lot about pelvic health lately, right? Anyone who listens to Mel Robbins too, she's had some great shows about that. Lots of different podcasts are talking about it. What do you want us to know about our pelvic floor, like at the most basic sort of rudimentary level?
I want you to get rid of the idea of the pelvic floor in a lot of ways. I mean, I think you need to hear the word pelvic floor. It's kind of like a catchword. But I just want you to understand what your anatomy is. If you think of the pelvic floor, it's the jaw of the mouth. And to understand that concept is not easy for us because this goes back to sort of our own child development. When we're trying to figure out how our body works, when we're infants and we're trying to grow into our childhood years, we learn to move our body and understand our body in multiple ways. We learn um, by naming our body parts, by watching our body parts move, by touching things, by feeling things. It's the way we sort of know ourselves in the world. And the pelvic floor is totally invisible to us. It's inside of our bodies. So, for us to connect to that area, we need some cues, and we don't get any. Which is why it's kind of invisible on our brain maps, and it takes a long time for us to be able to connect to that muscle. It's just something that we're meant to connect to, but we often do not. And because of that, we don't learn to open the mouth.
Mm,
And that's something that we need to learn how to do for multiple reasons. So that connection from our brain to our bottom is something that we should be getting through child development, yet most of us never get there. We never do.
mm,
We spend our whole lives disconnected from that part of our body, and it causes us physical harm, not just in our symptoms, in our pelvic floor symptoms, in the sense of incontinence or urinary tract infections or prolapse, but also in our whole bodies. The pelvic floor controls the natural flow of our body, and if we don't know how to control it, we get backed up. I don't know. That's a good way to
mhm.
explain it, I guess.
Yeah. Yeah. And, I mean, I think remember just a few years back, we were out to dinner one night. And when all of this we were having these conversations about this for the first time. And I thought to myself, wow, I've known you for how many years? I never thought to ask you any questions about the pelvic floor or anything. And I'm like, I'll get to you when I'm 70. But the reality and the data shows that women, and you're seeing women in your practice as young as in their 20s having stress incontinence and lots of issues around this, which is making this even like a bigger conversation right now, right?
Absolutely. When you have a pelvic floor disconnection, it can affect you in any age, and that could be from childhood up until late adulthood. But for the most of us, we don't really have terrible symptoms from this until we get old. But we are seeing younger people with these symptoms, and that has to do with stress levels. So if we're not in touch with our pelvic floor, if we don't really understand how it works or how it moves, when we're stressed, we can get into more trouble with our physical symptoms. And so I do see a lot of young women coming in now with problems that you really should only be seeing in older people. And I think it's just because of the stress levels in this population. And listen, the 20s, the late 20s, the late teens, these are very vulnerable years for women. And it's when we're trying to figure it all out, it can be very stressful. So
Mhm.
I don't know, maybe the pandemic made things worse for people. I'm not really sure, but I do
Mhm.
see a change in the practice.
Yeah. And one of the other symptoms is having UTIs, a lot of UTIs. You're seeing a lot of UTIs as well,
Always have
right?
seen a lot of UTIs,
Yeah.
yes.
How does that play out? What is it about the pelvic floor, what we're doing or what we're not doing that's creating more UTIs?
I think what we need to understand is that when we are toilet training, we need to learn how to release urine from our bodies. And when we don't know how to properly release urine from our bodies, we can get urinary tract infections. Um, and I know that most people don't think they have problems urinating or they're not paying attention to it. But the problem is that when you've been living in a disconnection your whole life, you don't know what normal is. So when you think about it from a developmental perspective, when children are learning to toilet train, they learn to hold. That's all they learn. That's how they get out of diapers. And holding is really so much easier to learn than releasing because from a neurological perspective, holding is in our flight or fight response, and we are wired for fear. As human animals, we're wired for fear. So it's very easy for us to go into a fear response, which goes along with our holding response. Okay, um, what we have to learn to do is unhold, And that's not easy for us to do. So for most children who are learning to toilet train, when they urinate, they're starting with pushing behaviors or postural behaviors, and this is very normal for young kids to push to urinate. It's so normal that it really becomes part of their brains. It's so deeply wired that they don't even know they're doing it. And it's fine because it works. But the problem is, as we get older, if we haven't learned to release urine without pushing mechanisms, we start to get into real trouble. And UTIs is one of those things. We're not supposed to push to release, and most of us are not even aware we're doing it.
Mm. Yeah, so I mean, let's the first time you shared this with me, even I was just like, "Wait a minute, but you have to push a little." So, but this is you, again, you have a breathing
You don't.
technique.
You don't
Assist,
have to push a
exactly.
little.
Set us
Someone
straight
needs to
right
tell
now.
you that you don't have to push a little, and actually, you're not supposed to do it.
Mm,
You can do it, but what you're doing is you're using your spinal reflexes to urinate. So basically, you're urinating like you have a spinal cord injury when you don't. This is how people who have spinal cord injuries can get urine out, and we have much higher brain level processing to get urine out than that, but we have to be connected to in order to do that. And this is where we talk that disconnection comes in. If you're disconnected from the muscle that needs to drop down, you will not be able to release urine without pushing. And that pushing behavior is going to cause you harm over time.
mm. Okay, so if we're not pushing, what are we doing? What do we need to be doing?
Oh, Marjana, we need to learn how to breathe.
Yeah.
Okay, and there's been so many aha moments along this journey, Marjana, but I would say one of the biggest aha moments was the understanding that we do not know how to breathe. We don't.
Mhm,
We never learned. It's not just that we don't do it, we don't know how to do it, just like we
mhm,
don't know how to release urine from our bodies. These hows are things that need to be taught to us. We don't pick them up on our own. And
mhm,
if nobody's teaching them to us, we do not learn them and we continue in dysfunction for the rest of our lives.
mm,
Learning to breathe is a very complicated thing. It has multiple synapses. Synapses are brain connections or nerve connections that you make along the way. Sorry.
mm. That's all right.
So yeah, so this is so through a simple teaching of how to do these things, not only can you learn them, but you start to connect to the other side of your body, and you make a mind-body connection that guides you in everything: your postural maneuvers, your emotional well-being, your ability to regulate your nervous system in times of stress. All these
Mm.
things are very important for adults, and if we don't toilet train or learn to breathe properly, we don't maximize these abilities.
Yeah. So, lots of people might be thinking, "Come on, I know how to breathe. I know breathing techniques. I'm meditating now. I'm doing
Yep.
lots of things." So, break it down for us on how we're doing this wrong when you consider it, especially with our pelvic health and how it relates to that.
So, for all the people that think they know how to breathe, I want you to know I did not know how to breathe. I do know how to breathe now, but I can tell you that I give you a lot of props because I knew nothing about breathing. I mean, before I learned all this stuff, I would say I was a mouth and chest breather. I was an upper half breather, meaning I used all the muscles of my neck, my shoulders, and my chest and my upper back to bring air into my body. That's how I did it. I never even thought about it. As I started to pay attention to these behaviors, what I realized was that I wasn't really breathing at all. I would go through many, many seconds, even a minute, without taking a breath. And it started to occur to me that if I didn't pay attention to breathing, I wasn't breathing. And this is the evolution of this thinking, this understanding. When you learn how to breathe, it's always because you thought of it. It never happens if you don't. And so when you breathe, when you learn to take a breath, you have to learn to use your nose, but not just nose breathing. It has to start with a sniff. And the sniff is the big word of the day. Okay. So I'm a urologist. I know nothing about ENT. I really, this is not my field. However, when your sniff is what starts your urinary process, you better learn about sniffing. And this is a holistic way of looking at the human body to understand it's not just about the bladder, it's a whole body experience where you learn to release urine through proper breathing.
Right, and as you explained to me and you explain to your patients, the sniff, like,
Yes.
deeply sniffing in,
Yes.
it really
Yes.
you start
But
to feel your
before
bottom
you
opening up.
take it as a breath, right? It is so when
Mm,
you sniff, you're literally doing two things. You're engaging your diaphragm. By the way, the diaphragm does not engage without a sniff. Everybody
mm,
who thinks they know how to diaphragmatic breathe, if you're not starting with a sniff, you're not engaging your diaphragm. You might
mm,
be moving your diaphragm, but you're not engaging it.
right, you
So the
might be
sniff,
popping out your belly.
you might be
Eh,
popping out your
oh,
belly. Listen, a
yeah,
lot of people think belly breathing is through their mouth. You cannot belly breathe through your mouth, okay? So
mm,
the nerve pathways is a coordinated pathway that starts with a sniff, engages your diaphragm, and relaxes your pelvic floor all at once. It's a quick millisecond thing. So when you take a sniff, and believe me, sniffing is not easy. I'm just going to show you with my face, okay? So my face is fully relaxed. My mouth is closed. My lips are almost even a little pulled in, and it's a quick rush. When you do that, you notice that your belly pops out. And we call that the sniff reflex. Okay, so you're totally relaxed in your face, your upper half. It's just a quick internal rush through your nose. That's a when we in medical school we learned to test the sniff inspiratory pressures to make sure that the diaphragm was working properly, that the phrenic nerves were working properly. Um, when you sniff, that's the start of a breath. When you take that rush, that's actually a breath. Although for a lot of people, they don't know it's a breath because the chest isn't moving. And we're so conditioned to think that our chest should be moving when we breathe. It should not be, it should be frozen. And if you can push your belly out with that sniff, you're bringing air to the bottom of your body and you're increasing the blood flow at the bottom of your body into your pelvic floor. You're also opening the mouth at the bottom. And that's how you release urine with airflow. And this is a concept that is quite simple. Just you need to push with air instead of pushing. But if nobody tells you that, you never do it, you never know it, and you're obstructing your flow if you don't do that. So
mm,
you better pull the air to the bottom on the toilet for urinating and defecating.
yeah, and that right, and this really helps even with constipation, like, people who
Oh
have
my God.
right? Who just
So
yeah,
so this is the truth, okay? And I don't like saying this in public forums, but I had 50 years of it. 50 years
mm,
of total. And
mhm,
now nothing. Totally turned around. And listen, I thought, oh, this is just me. This is crazy. No, my patients too. I have patients with irritable bowel, all these problems. It turns around when they learn to breathe. That's a
mm,
breath. Nothing else is a breath. And when you understand that that's what you're supposed to do 8 to 10 times a minute, you understand how you're supposed to be.
mm,
And that breath stimulates the parasympathetic side of your nervous system. So it's really a calming breath. And God knows we all need that today. We all
mhm.
need to be able to calm ourselves down.
Yeah, yeah.
Yeah.
I mean, wow. When you say breathing like that 8 to 10 times a day, okay,
No,
you've
no, 8 to
become
10
more
times a minute
a
more.
minute, that's it, not a day, 8 to 10
A
times a minute.
minute.
Tell me
Yes.
I mean, you're doing this consciously and intentionally, but even
Mhm.
you say sometimes, like, you forget, "Wait,
Are you kidding?
I was
I
holding it
can't
in."
do it. Who can do it? Nobody
Y
can do it, but it's a goal. Okay. So this is
right.
what goals are about. And you can set pretty lofty ones. I set lofty goals for myself all the time. I want you to know what your body expects of you. Your
Mm,
body expects even complete oxygenation all day long. That's what it wants. Now, whether
mm,
or not you give it to it, that's a different story, right? But I want you to know that you don't have to be perfect at this to see results, okay? You have to bring it into your mind whenever you can. And when you
mhm,
take a breath, that's just how you do it. And that's a second nature thing. So when you start to practice this, you realize that when you take that breath, your lungs are filling in a calmer way. You're getting better oxygenation. Your pelvic floor doesn't feel like it's rolled up in a ball. Listen, your pelvic floor is at the bottom of the body. It's a muscle. It gets no air unless you give
mhm,
it to it. A sniff is air and blood flow to your pelvic floor and it needs it. Your bladder needs it. That's giving blood flow to your colon, to all your lower organs. And it's helping you develop a sensory motor awareness of your core. Okay,
Mm,
the core is the area. If you want to think about the core, it's the area from the bra strap down,
mm.
okay? Down to your
And,
pubic bone.
like, that's the core and that's the pelvic floor.
It's the
Everything from your
core. The core is the
mm,
bottom of the pelvic floor, okay?
okay.
If we're in an upright position, if we're in a lying down position, it's not. But the core is the area from the front, your abdominal wall, your back, your lower back, your mid to lower back,
Mm,
and your bottom. And at the top, it's the diaphragm, which is the area of the bra strap, okay?
mm,
That space is your core. And that's the space that you need to expand with air when you breathe. And it only expands when you sniff and let it go. So you have to learn to release your abdomen. And for most women, that is a neurological milestone. We are all sucking in our guts like you cannot believe. We are compressing our organs and decreasing the blood flow to the bottom of our body by sucking in our guts all day
mm,
long because our mother told us to do it. And listen, our mothers knew a lot of things, but they didn't really understand posturing and physiology the way we do now. And we have to understand that sucking in our guts is not what we're supposed to be doing. We're supposed to be breathing with our abdomens relaxed and out. That's how we breathe. And if you are standing in a position where you're standing so upright that you have to suck in your gut, you're suffocating your bottom. You should know that.
mm. Okay, so I mean, you're right. Some of us are like we're just prone to wanting to the posture thing and to suck it all in. So is there no way to do that while still breathing properly? You know, to feel like you're kind of holding it all in and have really good posture. And I kind of feel like to breathe this way, you got to like slump over a little bit and you got to be a little frumpy feeling. And
Okay, you do not have to be frumpy. Here's the thing. When you actually stand properly and breathe correctly, it looks totally normal to the average person. First of all, I want to get something through to people because and listen, I don't know what our age group is that's looking at this, but like is it the 18 to 20-year-olds? Because if it is, I'm not going to get through to an 18 to 20-year-old. She's going to suck in her gut. That's what she does. But when you're 50, you do not have to hold your stomach in. First of all, no one's looking at you. I hate to say it, but they aren't. Okay? You might think they are, but they're not. They don't care. The only person who cares is you. And you are trying to hide your belly from your brain. We all have a round belly. That is how we are designed. Okay? That's our design. And the
Mm,
reason we have a round belly is so we can breathe and so we can bear children. Sucking in our stomachs is not what we're supposed to do. We are the only animal in the animal kingdom that does this.
hmm,
We're the only ones.
uh,
Okay.
and it
So
was all driven by vanity, you think?
no, no, no. It's driven by posturing. It's
Mm,
incorrect posturing. So we were taught this military stance of posturing, and that is normal, but it's not good. Listen, anybody who does any kind of physical therapy, know we're 4 degrees forward. We should be 4 degrees forward on our hips. Okay. And I'm not going to stop posturing right now. But if you are 4 degrees forward and you are not with that lordotic spine, if you're pulling your back in and giving yourself a straight spine, okay, and letting your belly go, you can breathe. You're 4 degrees forward with your shoulders. You don't look that way to the average to the person who's looking at you, but most women are standing like this and chest breathing and sucking in their guts. And first of all, I'm just telling you, it doesn't look good. I see older women doing this, and I'm like, can you just take it down? It looks weird. It really does. To have that kind of like, it doesn't look good, and your chest bones are jutting out. This is because you don't know how to breathe. Okay.
mm,
And this is a respiratory issue. Like I don't at some point you just gotta say, my health is more important than what I think I should look like.
mhm. Yeah. I mean, so in your practice, when you share this, by the way, I'm because we're in real time here. So could that be, is that anyone texting you going, hey, I have a question. I have a
No, no,
question.
no.
If
Believe it
anyone
or
has
not, I'm on
questions who's
call and I'm
watching you,
trying
drop it in com.
trying to
What's
deal with the call service. Um,
oh my gosh. I mean,
no, it's okay.
you are a doctor, you're a surgeon, you're on call, you gotta pay attention to your phone.
Sorry.
I
Yeah,
get it.
I didn't mean to
No,
get
it's
distracted.
no, no, absolutely. It's good. When you share this with your patients and you're like, you don't know how to breathe. I want you to share how you are as a doctor with your patient. You're so
Oh God.
real and raw and just give it to us straight because I know sometimes it's
Listen,
like
listen, I
painful.
gotta tell you, I hope my patients are getting used to me. It's always like culture shock when people come into my office because they think they have an appointment with a urologist and they come in and all they do is learn how to breathe, which is hilarious. And this is very different from the way my practice used to be. But listen, I do a lot. I do surgeries. I do give out medications. Believe me, I practiced. I did an allopathic medical training like all of my colleagues. But I just realized that if I didn't understand these mechanics, I couldn't help people because these structural problems that we create, I can fix. But if I just fix them and I don't tell you to stop pushing out your pee, you're going to drop your bladder down again, or you're
Mm,
going to have other problems. And it's not that I don't think that reconstructive procedures are correct. A lot of times they're really necessary, but they're never the first thing. They're never number one. Number one. So now I have, I have a guy. I teach my patients the ABCs. Okay, um, and this is what I think the wellness industry should really be like. So when we're learning basic life support or ACLS, we learn the ABCs. So if there's a critical patient lying on the floor, the first thing you do is you make sure they have an airway. So airway is A. The airway's the nose. I know we think the airway's the mouth, but it's really the nose. Our bodies are designed to breathe through our nose. The mouth is the emergency airway, and we're all using it as the airway, which is a problem. When we don't breathe with our noses, we're missing out on filtering the air in, on the moisture that we get from the air. It's just the immunity we get from breathing through our noses. It's much different. The mouth is like the garbage air, it's unfiltered. It's just not as good for us. So a, airway is your nose. B is breathing. How does air enter your body? Does it enter with your upper half or your lower half? Your lower half is your breath. So the sniff is the airway and breath. Okay. C is circulation. That breath is going to circulate blood flow all throughout your body evenly. Those three things are the patient's responsibility. I can't do that for them. I can do D, which is drugs. They can do D, which is diet. They can do E, which is exercise. But D and E do not come before A, B, and C. And I think we put it before A, B, and C. So now I say
mm,
A, B, and C is you, girl. I don't do
mm,
that. I can show you what to do, but that's you. And if I do D or I do S, which is way down at the end of the line, S is way down surgery, you got to be doing A, B, and C, or I'm not going to touch you. And
mm,
this is the partnership we get into. And now it's 50-50. And I have to tell you, my practice has gotten much better since then because I learned that when the patient does A, B, and C, my
mm,
S works great or my
mm,
D works okay. But sometimes we don't even need to get there. Sometimes we just stop at A, B, and C. And that's where I would like you to stop. I would
mm.
like you to learn how to breathe, pee, and poop correctly. And sometimes that's all you need to do, and all your problems go away. Isn't that wonderful?
Wow. Yeah. So give us an example of some patients who come in. Is it stress incontinence, right? Because again, we're seeing many more women having that at younger ages, right? So if I came to you with stress incontinence, what's the process that you would follow with me as a new patient with that symptom?
Well, let's define what stress incontinence is because I don't know how much people know what stress incontinence is. Stress
Mm,
incontinence is a very common type of leakage that we see after childbirth. So it means that when we cough or sneeze or laugh, our urine comes out. And this is not when so we almost feel like we don't have the ability to hold it in when we're increasing our intra-abdominal pressure.
mm.
And we call that stress incontinence.
And is that only if you've had a vaginal birth, or is that also if you've had
No, it's not
a
only. You could
C-section?
have stress incontinence even listen, we see young track runners, 16-year-old with stress incontinence, but
Mm,
stress incontinence just means it's a weakness in the opening of the bladder. Something's weak. And it's most common after a vaginal delivery because that's when we start really tearing things and decreasing the resistance at the opening. But it's not only for child. I've had women who've only had C-sections. Sometimes it's just that your tissues are naturally genetically a little bit weaker. Some people just don't have, they have stretchier tissues and they're more likely to get problems with stress incontinence, even if they haven't had a vaginal delivery. So there is some genetics involved with it too.
mm,
But it basically just means that when you cough or sneeze or exercise, urine comes out, which is different from urge incontinence, which is I can't get there. I'm
mm.
trying to hold it and I can't. And it's nothing to do with coughing or sneezing.
Mhm. And in a case like that, even when you say the urgency, so again, the breath, the sniff technique that you're
Hmm.
teaching your patients,
Hmm.
it can literally help you change that, turn that around,
Oh,
you
it
know?
changes everything. I mean, it changes. Mostly it's for urge. So the idea behind breathing with sniff enhanced respiration, which is what I call it, it's just sniff enhanced respiration means the sniff is the pathway for breath. You can't get off that path. If you go into the sniff brings is the reflex that brings the air to the bottom, and it's
Mm,
the only thing that opens the sphincter muscles below. But what I like to think about about that type of breath is it's the way to oxygenate your bladder. So for your bladder and your colon, all your lower half organs, I want you to know they're perfect. There's nothing wrong with them. They are perfect in every way, and they're so complicated and they're so beautiful. Okay. And our bodies are designed in this amazing way. Um, but they cannot operate without oxygen. See, oh, here's the thing. They can do any job that they're supposed to do, but they need air. And aren't we like that? I mean, if someone's suffocating you, can you think?
mm,
Right? So you can do things if you are breathing. If you have oxygen and blood flow, you can do them. So that's different from how most of us manage our bladders. When our bladders are trying to do things, we clamp around them. We clamp.
mm,
Okay. And
yeah,
that is going to totally paralyze your bladder from doing its job. So
yeah.
instead of thinking about how am I going to control my bladder, I just want you to think I'm going to give my bladder air so it can do its job for me. And that's the neurological sort of mechanism, way of understanding how to stay continent. Because if you
Mm,
give air when you're walking around, your bladder will never rush you to the toilet. It might tell
mm,
you that it's full, but it's not until you clamp around it that's when the leak
yeah,
happens. So
yeah.
you have to just start becoming more aware that you don't need to walk around holding in your pee.
Mm,
If you do that, which most of us do because we've been doing that since we were kids, we just hold,
yeah,
your bladder can't breathe, and it's
yeah.
going to rush as we get older, especially when we go through menopause. It's going to start rushing us to the toilet constantly, and it's only because you're suffocating it.
Mm.
It's just
I have to say, right, since we've started talking about this, I've been testing it here and there, and I was in the city recently, long walk, we were going, with the kids and all this stuff, and I was just at a point where I'm like, "Oh my gosh, I need a bathroom, I need a store, I need a place," and then I was like, "No, calm down, breathe, you'll be fine." It
just take a
really
sniff.
worked. Yeah,
Take a
it
sniff, yes.
worked.
So it's the panic that sets in that makes the urgency worse. And so you have to realize we are very complicated as beings, and this is where urologists really missed out. I think we have to understand the neuropsychiatric stuff that goes on with holding for us to really help women. Um, we really, when we're in when we're in fear mode, we're gonna have to pee so badly, and the more you have to pee, where's the bathroom, the more you're gonna have to pee. So I just want you to know your bladder will never leak on you if you give it air, and you may not believe that. The brain is a funny thing. It needs to be shown things. Like I could tell you something and you might understand it with words, and intellectually it might make total sense, but until you actually show your brain that that's true, it's not going to happen. And if you're not going to sign on. So you kind of have to take a leap of faith here and say, I'm in a space where I really have to go. I'm going to take a breath and I'm going to see that my bladder just calms down. I'm going to go in the other direction. And I tell all my patients, look, you've been thinking about this stuff a long time before you came to me, and I know you've been trying a lot of things. The internet is rich with what can I do about my bladder. So I'm sure you've been trying your Kegels exercises, and how far are they getting you? Because here you are. um so let's do something different. Let's just go in the opposite direction, and that's child development. Okay, you need to go in the opposite direction. You can't manage your bladder like you did when you were 3. It's not going to work.
Mm. So you just said Kegels, and I want to make sure that we touch on that. And again, in this series, we're going to like unpack all these things over these next few weeks. But let's talk about Kegels because you're the first person that I learned from that maybe that wasn't the right sort of direction to go in, as you're saying. Can you explain that piece of
Listen,
it?
I don't have any problem with exercises in general. Exercises, if you're aware of the other side of your body and you have sensory motor awareness, I don't care what you do. Really, truly, I don't care what you do. But what I object to is you doing Kegels when you don't have sensory motor awareness of the other side of your body, which, by the
Mm.
way, none of you do. Okay? I'm just telling you, you don't. Maybe you do it today after this conversation because it's not hard to build when someone tells you this. But um, Kegels are kind of stupid. I'm just
Mm.
saying. Uh, Ke- We know we learn how to do Kegels when we're 3. That's how we learn to toilet train, okay? And I don't think that anybody needs to do that more. We need to stop doing that. All right? That's
Mm.
how we got here. So so I'm not the only one that thinks this way, just so you know. There are as a whole school out there of pelvic floor therapists that do not teach Kegeling. The problem is
Anymore, like they used to,
anymore, I
right?
don't know. Listen, I'm not a pelvic floor therapist. I just
Mm.
have some friends who are. I don't know the evolution of their own training, but they really do believe in teaching things like breath. They
Mm.
do concentrate on those types of things much more than Kegels. But in the general population, we have a dogma. Okay, and that is also in my medical field, and it's a disconnect even in our field where we still think that that's what we should be telling women to do because we don't know what else to tell them.
Mm.
It's so much more complicated than that, okay? And Kegel is not going to make you better. It might help for temporary reasons because you're learning to suppress your bladder. You're strengthening your suppression of your bladder. But you need to understand you're not supposed to be suppressing your bladder. You're not in a battlefield with your organs, okay?
Mm.
You're trying to learn what your organs want, which is
Mm.
mostly just air. I hate to say that, but that's all they want. And listen to them and not try
Mm.
to clamp around them to get them to stop talking to you. That's not the idea. And that's what learning to Kegel down there does. And
Yeah,
it's not going to last you forever. And it's going to cause you pain too.
yeah.
I can't tell you how many people come to me with pelvic spasm and bad pain and worsening urgency and all these things after they start doing their Kegeling.
Mm.
Just stop. Don't do it.
What
Don't do it.
what so you don't see in any sort of case, I know this is hard because there'll be people listening who do the Kegels and who, talk about the Kegels, but for you, you believe right now there's no reason to be doing Kegels. Like you should be
Okay, you have to understand the second mouth model. Okay, when you understand the model, you understand why Kegels are stupid. Okay,
Mm.
your vagina is a mouth. The pelvic floor is the lower jaw. So you can drop the jaw and open the mouth. Okay, you can raise the jaw and close the mouth. Those are the only two motions that the mouth makes. Now, the mouth does some chewing too, and maybe you could say that's kind of like Kegeling, chewing. But if you have TMJ, if you're a jaw clencher, would any dentist say, just tighten until your teeth fall out of your mouth? No, you need to
Mm.
go in the other direction. You need to relax and
Mm.
open, okay? And that's the neurological milestone. We're born with a closed mouth that we don't know how to open. We're like this one, we're peeing through a closed mouth. And I want you
Mm.
to open your bottom on the other side, which means your tailbone is literally moving away from your pubic bone. And that only happens with airflow.
Mm.
That's how you do it. It moves your tailbone away from your pubic. That's how you pee. You can't clamp while you pee. That's why we're dysfunctional voiders. And that's what
Yeah.
children do. We clamp while we pee. And we don't know
Mm.
we're doing it. It's
Yeah.
it's just it's just we don't know. It's involuntary reflexes on the other side that we need to become aware of so we can stop.
Mm. So this new way of breathing, the sniff, we're gonna sniff through it all, right?
Exactly.
Does it help with painful sex, with dryness, with things that come with menopause, perimenopause, things like that as well?
Okay. Listen, this is just, I'm going to tell you how I practice, okay? I'm not going to tell you that we have randomized controlled studies that show that sniff enhanced respiration gets rid of everything. But I want you to just think about this on a physiological level, okay? When you're going through changes, when you're going through menopause, what we are losing is our estrogen, all right? Which is a great way to bring blood flow to the other side of the body. Estrogen just brings blood flow to our vagina, makes our vagina healthy. When we lose estrogen, our vaginas are basically deoxygenating. We're
Mm.
getting ischemic. And a lot of the stuff that happens with age is really based on ischemia.
And
Ischemia
what's
means
that?
lack of blood
Yeah.
flow, lack
Okay.
of blood flow, because estrogen helps bring that blood flow to the bottom.
Mm.
Um, if you're not supplying it, things get worse. But if you
Mhm.
are supplying it, you can you can halt. So I'm not, listen, aging is going to happen and death is a sure thing. So anybody thinks that we're going to prevent death learning how to breathe, it's not true. But what we are going to do is we're going to bring quality of life to our living time. And who knows,
Mm.
maybe it will increase our lifespan. I think there's a lot of studies that dysfunctional breathing is really at the heart of chronic illness. And
Mm.
so here we go. You're a dysfunctional breather. Learn how to breathe and actually do it. It's not
Yeah.
just about learning how to do it, it's about doing it.
Mhm.
And doing it whenever you think of it. And let me tell you, it feels so good because you start to
Mm.
like feel like you're getting oxygen. You start feeling
Yeah.
like it's better for you.
Yeah, yeah. No, you're right. You're right. I mean, again, we're breathing all day long, right? But when you stop and intentionally breathe this way and take that breath in and release down there, it just it does. It feels so much better.
And
You
you
feel
realize you've
calmer.
been
You
butt
feel
clenching all day long.
mhm.
And let me tell
Right.
you, this is when, so for people who go down this path with me, the first thing they notice is that they're butt clenching. Okay. And that's great because I want people to notice that I'm butt clenching. Okay. You don't even know you're doing it. Start paying attention that I am butt, and you notice first time you put your attention on it, you see you're doing it all day long. And that's
Mhm.
okay. That's okay. It's like just noticing it is the very first step. And
Mhm.
then learning how to take it down with air. And as you start to do that, your body stops clenching so much. We don't need to clench to hold in pee and poop. That's not our job. It's just that we think it is. It's so ingrained. So we have to just tell
Mhm.
ourselves it's not my job to hold in my pee and poop. My body does it for me. It just wants the air to do it. And that's the last stage of child development, in my opinion.
Yeah. So I know we want to make sure we don't go over overtime today, but the last few things like I want to cover is well, one, just anyone walking away who has heard you today. What the one walk away is that you want them to know about the sniff? Is like what can they do today to just start opening their bottom better and just start
I want you to just
understanding
make a
it?
brain connection. My dream is that I could just say this to the world and the world would instantly make a brain connection. It's not easy to do. You have to be calm and you just have to notice that when you sniff, your bottom opens up. It's a very simple brain connection, but you have to be paying attention to the other side of your body, the part
Mm,
you're sitting on, to feel it happen. And the stronger you sniff and the more you just let go, you realize that that is the pathway for urination, defecation, and breathing. And if you don't know that's the pathway, you won't ever do it. And
mm.
that's all I want people to know. It's listen, I can shut up right now if the world gets that, but it's I think I need to talk a little bit more.
Right. Right, exactly. And tell us a little bit about what your colleagues are understanding about this as you've begun to share this in different circles of your community of colleagues.
So I would say that everybody's open to it. It's I think all of my colleagues are suffering a little bit. Medicine is not easy to practice, and these things that we treat, especially in my field of pelvic floor dysfunction, they're very complicated, and we really don't have the time to spend with people like we want to be able to talk people through these things. So it's very easy just to hand out a medication, and it's very ungratifying for many of my colleagues too. They really do want to help people. And so just sort of this understanding that there's another way to think about things is exciting to them. But it's going to take some time, I think, because our system is not really designed for doctors to be teaching breath work, especially urologists. So I shouldn't be toilet training people. I mean, I'm a surgeon. I spent 7 years in residency and fellowship, and I'm actually a very good surgeon. I think that's my skill set. So for me to be toilet training everybody is kind of silly. It should be pediatricians, it should be mothers, it shouldn't be me. But here I am with this understanding, so I kind of have to do it. And I think my colleagues have to do it too a little bit. They just have to understand these principles, and I think they will over time. They're open, they're not rejecting it. It's just
Mm.
weird. It's just something they haven't thought of.
Yeah, and it seems do you find that they're like, "That seems too simple," almost? Has anyone said that? Like, "Really? It's gonna
Well,
come down to this?"
I think that's a truth. And I think the most complicated things are actually quite simple, but we've missed them. That we just haven't, it's really in the action. You could study something and understand it on a very intellectual level, but this is the crazy thing. I have yoga teachers that come see me and they don't know how to breathe. And they're
Mm,
teaching yoga. And I'm like, it's one thing to understand things on an intellectual level, be able to coach somebody through it, but for you to actually do it, it's harder.
yeah, yeah. Last so data. Give us a little bit of just data to just so we could walk away really thinking about how important this is in terms of like the data of what you're seeing with patients who are having a lot of these ailments and issues and things that again can be not cured but healed but changed through the sniff mechanism that you're teaching.
So the kind of data that I want to get is almost impossible to get because real world data on how people breathe is we're never going to get that. We could try, but there's too many variables. So what I had to do was I had to find a small piece that I could just say, here's rock solid data that what I'm saying makes sense and is true. So in our field, we deal with a problem called urinary retention, which means that someone can't pee. All right.
Mm.
And when we see that commonly in women is after surgery, especially surgery to fix leakage. So that's a very common thing. It's usually transient, it's usually temporary, but it's very annoying for the patient and for the doctor. So we call that post op urinary retention. And I did a study where I taught people sniff enhanced respiration, and I didn't teach people sniff enhanced respiration. And when we did their procedures or their surgeries, the patients who learned this didn't have postoperative urinary retention nearly as much as the ones who didn't learn it. And I was using verbal cues with all of them, saying don't push out your pee, relax to pee, but that's not enough. You have to understand within your body how to release urine. So the ones that learned that, they almost never needed to be catheterized. It was like hardly ever. And the ones who didn't, if they had surgery, it was like 50%. And
Mm.
that's a big difference. So that data was presented at the International Constant Society, and the manuscript is going to come out, and that's real data. So I
Yeah.
I don't know what else we're looking for. You can pee better if you sniff.
Yeah.
That's what it says.
I like we need that on a t-shirt. You can pee better if you sniff.
Yeah, that's
I
how
like
we're
that.
supposed to. It's how we're supposed to release urine, and we don't. Nobody's told us that. Nobody ever said this to
Mm.
us, right? Did you
Yeah.
hear this? No.
No, no, no. Well, what I love about your data is you're a practitioner in this space. Your data comes from your practice. Your data is coming from the patients. Your data is coming, and I know that you still do surgeries, but you've also shared that there are a lot of women that you have not had to perform surgeries on once you've taught them this sniff technique. Am I correct?
It's true because for many patients, they can get really fixated on what things look like, and doctors get fixated on what things look like too. Like, is my bladder low? Is it high? And we can lift bladders because we think it's low. But at the end of the day, if you fix a functional problem, which is how the patient is releasing urine, that bladder being low either goes back up or as long as it's not really out. If you have very mild prolapse, mild drops, the body is an incredible healing mechanisms. And when you start bringing some blood flow to the bottom, things really do shape up in a big way. I'm not saying that your bladder that's hanging at your knees is going to go back inside, but those kinds of prolapses are not that common. Most people have mild prolapses nowadays, and they can fix them just by fixing their functional behaviors.
Yeah. And I want to also, well, one, if anyone who's watching, if you have questions, if you want to add anything in comments, please do. And I'll check that before we go to ask any. Or afterwards, we'll post some things in Facebook, in LinkedIn. And if you want to reach out to Dr. Nicole Fleischman, we'll make sure to get those questions answered for you. But before we go, Nicole, I'd love to sort of end on talking about your book, The Second Mouth, and just again, why that name? Just remind us. I obviously we've been talking about it, but what inspired you for that name, and sort of what was that journey like writing the book and really saying, I'm ready for this. I'm ready to be able to share this information and just that feeling, because there are a lot of people who might be watching who also might have things that they need to share with the world, and I just love your journey, almost like as an entrepreneur with this as much as a doctor, of really being able to find ways to get this information out there and share it.
So I don't think I'd be doing this if I didn't have information to share. So I will just say that the only reason I'm out here on a podcast is because I have something to share, and that in it of itself is a journey, because I still have a very nice life, and I'm very happy. I have 3 kids and a husband, and things are pretty good. I mean, I feel very like my life is great. But when I had this discovery, suddenly this became the only thing that was really, I wouldn't say the only thing, but it became the most important thing to me. And it made me want to get out of a comfort zone to go and do something more than I had ever thought that I would want to do. I wanted to just start talking to everybody and talking about my ideas. And that's hard for a doctor, especially Nowadays, when everything's so evidence-based and evidence-based medicine, and if you're not saying things that are published in randomized controlled studies, you just shouldn't talk. And I started to realize that there's so much we know, and if we don't talk about it, if we just stay hidden behind what we think we're supposed to do in medicine, we are not helping people. We're not doing our job. I wasn't doing my job. And it just changed me, and it just gave me courage to just go out and start talking, even if I thought that people were going to say, well, how do you know that's true? And by the way, people do say that. And I tell them, take a sniff, feel it. That just knowing that that connection is there in all people, it's like I just can't shut up.
And we don't want you to. No, well, I have to share. I mean, listen,
For
so to just
now.
to just say for anyone that has joined us here, we'll see this later. We're going to continue this every Sunday. Why is it so early in the morning, 8 a.m.? Because you and I have found this time to be something really special over these last few weeks that we've been having these conversations. And we just wanted to open that up to recording it. We'll be posting it, post session and all of that to really start sharing this message in a bigger way. Right, Nicole?
Yeah, and
And
I want to hear from people too. I would
yeah.
listen. I think this could be something where we all share. You have to have courage to get on and talk to me, but I'll talk to anybody who has questions, because truthfully, I think until we start talking about this stuff, we're not going to understand it. And it's something that is
Mhm.
in all of us. Pelvic floor dysfunction is a universal condition. By the way,
Mm,
men have it too. But until we really openly have conversations but what we're really feeling and what's going on, we're
mhm.
not going to understand these complicated things.
Yeah. Yeah. No, definitely. And I think for anyone listening, also, if you have daughters, sons, I mean, it's harder, I guess, with the sons to teach them this, but I know with my daughter, I have talked about the sniff and how to sniff when you go to the bathroom. And she's been trying to apply it. And, so just how should we just talk to our children about it? Anyone that wants to like walk away from this conversation and be able to share this with any of their children.
So remember, I look at this as the last stage of child development. Okay. So this brain connection is not something that a young kid can make. They're not going to be able to sniff and feel their bottoms open up. They don't have the cognitive development to do that. I feel that that is probably going to be around the middle school years that they're going to be able to make that brain connection. Your job as a parent is just to tell them that it's there. That's all. I mean, I think if any one of us had heard as kids that you're supposed to open your bottom or use airflow to pee, we might have figured it out. But we don't want our kids to have that struggle. We want them to have heard it so that when they're ready to absorb it, and they will be at some point, you got to reinforce it a few times. Um, they'll do it. They'll do it before you did. They'll do it before I did.
Right. They'll be on a better path. Is there anything else you want to sort of leave us with today, as we close off on this kickoff today?
No, I'm just happy to be here, and I'm happy that we're starting. Where we've been talking about doing this for a long time. I'd like to
Mhm.
see if there's interest in this. I'd like to see if people, if it resonates with people. I mean, that to me, this is I get a lot out of this too, because you have to understand I figured this stuff also out in my own body. So the worst thing is just to feel alone. I think we all sort of suffer in silence a little bit with these problems, and that goes really back to childhood. And I think that, the more connected we can feel as a community to these things, and just understand this is our neurophysiology and we can work around it if we understand these techniques, it's going to make us all feel more empowered. We're not alone. This is the human condition. This is what being a human being is.
Yeah, yeah. And like you said, we're trying to, I know for you, you want a movement around this. The more people that can start understanding it, the more people that can start sharing it in their communities, their own circle of trust, having conversations about this. Just the wiser we will all be and the better off for it, right?
Absolutely.
Yeah, just a consciousness around it and intentionality. And thank you so
Yeah.
much.
Yeah, I know. Thank you. Thank you for helping me, Murray. You've been great and such a great friend. And, you know,
Yeah.
yeah.
Well, we're going to be doing more of these. They'll just be getting better from all aspects. And so, for anyone that joined us, thank you. And we'll be sharing more after this. And, Dr. Nicole Fleischman, thank you so much for your book, for the conversation. And I just can't say enough about how just raw and real and grounded you are, like every conversation we have. And that's what I hope that people start seeing in you as we start bringing more of these conversations forward. That, you know, again, you're like that friend that you could talk to about anything, and you're so damn knowledgeable. Your book is so interesting, and the storytelling and the way you do this. So we'll have information about your book below for anyone that wants to order it as well. But I really look forward to continuing this conversation over these next few weeks with you, my friend.
Me too.
All right. Thanks. Thanks, everyone.